COVID-19 has definitely been a friend to no one. She has killed 761,612 people as of August 14th. She has impacted every aspect of society as we knew it. She is ravaging our livelihoods with absolutely no apology. But COVID-19 has not been fair with how she deals her blows. Well, no, it is not so much COVID-19 is unfair, but our unjust society being thrown into the spotlight brought forth from the disease. In a joint project from the Anti-Racist Research and Policy Center and the COVID Tracking Project, COVID data was tracked showing that in the US, Black people are dying at a rate 2.5 times faster than white people. Now, this is not a matter of skin color, ethnicity, nor identity. It is a matter of benefits and economic well-being. Think about it. Black people are still at an educational, thus professional, thus economic disadvantage, being held down by a system designed to keep them oppressed. The Education Trust found that in 2016, only 30.8% of Black Americans had a higher education, compared to the 47.1% of white Americans. This is not due to laziness. It is that they are working through high school and do not have the funds to afford a higher education. For some, a higher education is simply impossible, yet many still see it as a choice. So now you have less Black Americans with degrees, thus less professional choices, financial freedom, nor support. They are forced into these hourly jobs that are deemed essential, being thrown onto the front lines without expensive benefits nor insurances offered to full-time employees with base salaries. So now they're on the front lines, sometimes lacking the proper benefits, being forced, and their salaries are forcing them into these tighter neighborhoods, apartment buildings, reliant on public services, which are often exposing them even more. But COVID herself isn't racist. Our society is. She has just showed us the data to show that. And now in terms of South Carolina specifically, the data is even worse. Black people make up 27% of the population, yet account for 43% of the deaths statewide. This number is more than disproportionate, and the racial COVID tracker has flagged the state for racial disparity. Here at the college, it is essential that we take this into consideration when examining the effects of our reopening plan on our staff and surrounding communities. While Charleston County itself has recently shown census data showing a 69% white population with a median income of $64,000 or more, just a few miles away in North Charleston, their census data shows a 47% Black population with less than $40,000 a year. A lot of our support staff, specifically maintenance workers and similar essential service workers around campus, cannot afford the rent in Charleston County. In fact, according to Indeed, a South Carolina janitorial worker makes only $10.65 an hour, less than $30,000 a year. A lot of our maintenance workers are hired through third-party services, so it is safe to assume that this income is at least relatively accurate. It is impossible to pay rent in Charleston, the 48th highest rent out of 291 metropolitan areas, on that salary. So a lot of them are moving to North Charleston and other surrounding counties with a lower rent. Thus, not only are they exposing themselves, but they are now exposing these other counties. Not only are they exposing themselves, but now they are exposing these other communities who are statistically more likely to be hit harder by COVID-19 on a deadly level. Not only do we need to recognize this as a community, but do everything in our power to remedy this inequity and look out for the people of our community who are more vulnerable and on the front lines. While we are not attempting to change the socioeconomic status quo and its racial ties in the Low Country, although that is a long-term goal, we hope that the college recognizes the possible oppressive infrastructure it may be supporting through its reopening plan. It is absolutely imperative that we have guidelines in place to protect our administrative, janitorial, and specifically low-income BIPOC staff members. And we are currently working with the college to get something in place if this is not already a reality. Thank you.